So I graduated high school. I went to undergrad and studied communicative sciences and disorders. And then from there, went directly to my master's program in speech and hearing science. I did my clinical internships and externships. I did some in undergrad, finished out in grad, and came out with a master's degree in speech pathology. From there, I completed a 1 year clinical fellowship, which is kind of the equivalent of a residency for doctors. Like you're actually working in the field and you're getting paid, but you still kind of have training wheels. You have a mentor who checks in on your progress and makes sure that you're hitting certain goals and guidelines. And now I'm a fully practicing, fully licensed speech pathologist.
Welcome to the Unknown Options, the place where we explore the unknown options, the number one source for career apprehension and accessibility. My name is Will. Today I have with me Aris. Aris, great to have you here. Give us a rundown on who you are and what you do.
Well, thanks for having me, Will. Like you said, my name is Aris. I am a speech-language pathologist. I currently work in the adult setting, so by day I'm slinging graham crackers and taking voice recordings, and then in my free time, I try to hit a couple tennis balls a week. It doesn't always work out. I try to do some baking, a little bit of cooking on the side, just different things to keep myself active. Try different things. I'm a Charlotte native. Born and raised, so I'm glad to be back in Charlotte, serving my community, and yeah, just doing what I do best.
Nice. I love it. I love a tennis connoisseur. Your journey is important, so we want to highlight the good, the bad, and the ugly. For someone who might not know, what is a speech language pathologist?
So, a speech language pathologist is a person who works in the assessment, diagnosis, and treatment of speech, language, communication, and swallowing disorders. I always tell people that when I tell them I'm the speech therapist, as we kind of casually call ourselves, whenever I say I'm the speech therapist, the first thing I get is, my speech is fine. And it's not just that. So, really, if I gave you my full title, full rundown of everything I did, we'd be here all day.
Yeah.
But that's what a speech language pathologist is. We work across different settings, all across the lifespan, literally from birth to death. You will see a speech pathologist in every facet. We work in schools, in daycares, in homes, in private clinics, in hospitals. In my case, I work in the skilled nursing setting, in the nursing home setting. So, like I said, literally anywhere there is a need, you will see a speech pathologist.
Okay, I love it. My father's in a skilled nursing facility, so I wonder if I'll talk to you offline and see if you're in the same area as him because he's
Oh, yeah,
definitely
I'm sure he's
dealt with
running to
that.
us.
Yeah, definitely. Okay. Um, why is a speech pathologist important, and like what does it contribute to the general public?
So, in so many different aspects of life, a speech pathologist is important because it's kind of essential to how we function as humans. Kind of right under your basic needs of breathing, eating, sleeping, drinking. You have your need to communicate. That's how we are involved in the world. That's how we communicate what our wants and our needs are, how our feelings, how we participate, and how we show up in the world. So, from the communication aspect, that's where speech pathologists kind of make our mark. Like I said, all across the lifespan, from children who are experiencing speech sound disorders. And so, fundamentally, what they're saying is getting misconstrued, up to kind of in my setting where I'm more familiar, is with maybe an adult who's had a stroke and they can't even tell their kids that they love them or something like that. So that's really where we see our work is people being able to get back to participating into the things that are meaningful for them.
Definitely, I love it. I love it. My dad has had two strokes, so I can definitely relate on I guess on one I guess on the consumer side of that. Um, tell us your path from high school to college to now. Like, were you always looking to be a speech pathologist, or did you kind of change some point in your life?
So I think I'm one of the rare ones who always kind of knew that somewhere between high school all the way up, I knew that this was going to be my path. So in high school, I really credit a lot to my mom because she was helping me kind of figure out what it was that I was good at and what I wanted to do. I always was really interested in like neurology and the brain, but I was like, ooh, science, math, don't do those. So somewhere between that and like my skill with language and like English arts, somewhere we kind of did some research and came up with the pathway of being a speech pathologist. So I graduated high school. I went to undergrad and studied communicative sciences and disorders. And then from there, went directly to my master's program in speech and hearing science. I did my clinical internships and externships. I did some in undergrad, finished out in grad, and came out with a master's degree in speech pathology. From there, I completed a 1 year clinical fellowship, which is kind of the equivalent of a residency for doctors. Like you're actually working in the field and you're getting paid, but you still kind of have training wheels. You have a mentor who checks in on your progress and makes sure that you're hitting certain goals and guidelines. And now I'm a fully practicing, fully licensed speech pathologist.
Love it. So my next question was: is college required? And I mean, I guess according to your trajectory, I'm assuming it is. So is a master's degree required to be a pathologist?
Yes, a master's
Okay.
degree is required to be a speech language pathologist. You can come out with a 2 year program as a speech pathology assistant. So there's 2 year programs like you can do at a community college if you want to be a speech pathology assistant. And then some people, if they choose to just do their undergrad degree, you can also come out as a speech pathology assistant as well.
Okay. There's an ongoing debate. I mean, I think it's a never ending debate about like college is necessary, college isn't necessary. Do you
Yeah.
think college is crucial to you like being able to land this job and work it efficiently?
Yes, absolutely. So besides just, of course, your licensure requirements, even though I learn a lot in the field and there were a lot of things that you just have to learn hands-on experience, the fundamentals of the profession, of all the aspects that go into all the domains that we cover, you have to have pretty extensive training in this.
Sure. Okay. Is do you think like the barrier to entry, like maybe that master's degree, will it come down in the future to be like just a bachelor's? Do you think it's gonna like maybe go to be a doctorate, and it'll kind of lower that barrier to entry in the future?
I don't think it's going to come down for sure. Some of our counterparts, so we work closely with occupational therapists and physical therapists. And the physical therapist, the doctor of physical therapy is required, if I'm not mistaken. And then for the occupational therapist, OTD or Doctorate of Occupational Therapy is an option. I believe they still have a master's program. I'm not entirely sure of that track. Master's of practice. If you want, you can pursue a clinical doctorate in speech pathology or a PhD in speech pathology, but those are really more so for like faculty academic positions, not really required if you want to practice.
Okay, makes sense. Give us Aris's day to day in the position and like evolution. I don't know how long you've been a speech pathologist for, but like if your job requirements or I guess your day to day has changed in the time you've been one.
Not really. I would say my day to day it looks the same like schedule wise, but
Mhm.
every day is different. Just today we found out that we have an outbreak of like 10 plus COVID patients in the building that I work at. So
Oh,
again, your day to day looks a little bit different. But as far as what a typical day for me looks like, I'll get in, I'll review my patient schedule. I typically see, I would say like 10 to 15 patients a day, just depending on what I have to do. So I'll get in, look at my schedule. If I have any notes to complete, I'll usually spend a little bit of time doing those first before I jump in. I'll get there about the time that they start serving breakfast to the residents. So for any of my feeding and swallowing patients, I'll try to get in and see them while they're having a meal just because that gives me the best idea of how they're doing in a real life setting. I'll kind of bounce around the building at first. My building is pretty large and I see like a wide range of abilities. So some days I'm doing things that are like more high level, and then sometimes I'm doing things that are really low level, just like basic skills with patients. So it varies depending on like I said skill level. If I have evaluations to do, I'll do those. But really, kind of my day to day, it's the same but different. Like I said.
okay. I like it. If you were a younger you, and I know you said you always had your eyes set on being what you are currently. If you were a younger you, like say 18, just graduated college, the same options present to you, would you do anything differently than what you did?
As far as career wise, I don't think so. I think that being a pathologist, I need one. Now that I'm in the field, I see just how rewarding it is, and I know that's cliche, but it really is rewarding. Just seeing people make progress and helping them see it for themselves. I think that I would probably have explored some more pathways and more ways that we can do it because we are in every facet of everything. Like some of the coolest options that I've seen kind of related to speech pathology are there's a person who's a forensic speech pathologist. So she works with like criminal cases. There's like sports speech pathology, kind of involved with traumatic brain injuries pertaining to sports and head injuries that way. If you think about like movies where they're changing accents, you have dialect coaches that work in that way. So just the field is so broad and there's so many different places that it could go. I kind of wish that I would have explored that a little bit more because there are just so many facets to it. But yeah, there's a lot that I can do in it. And just because I'm in one setting now doesn't mean that's where I'll always be. So I like that it's broad in that way. I just wish that those options were maybe presented a little bit more.
Definitely. And I was gonna follow up and say like, can are you able to like pivot to those other like I guess subsets like forensics, or would you have to go back to school to like learn that, or like could you just learn it on the job kind of?
Yeah, no, I definitely don't think that you need to go back to school for any of those. Like I said, once you've got the master's degree, you're kind of set. Um, we do what we call continuing education units or CEUs. And that's basically just to, one, continue with our licensure to make sure that we're updated on the newest practices and evidence. But also, if you wanted to pivot to a different facet, like I'm in skilled nursing with geriatrics right now, let's say tomorrow I up and decided I want to pivot to schools in the next school year. All I would have to do really is take enough courses and get not qualifications, but just kind of enough to show that, I've become more proficient in this area since I've graduated. Because, of course, it's kind of use it or lose it. We learn everything in school, but then once you graduate, you kind of get set on your path. But if you just kind of get yourself back into that mindset and getting that knowledge, you can pivot pretty easily.
Definitely, I love it. Okay, well that culminates the first half of the interview. We're going to go to the not so speed round. We're going to ask you a few questions, and you can answer them however you like. The first question is: what are four words that describe or that define a speech pathologist?
Patient,
Okay.
definitely patient, resourceful, collaborative, and encouraging. So
Why
I think that's what
encouraging?
I'd say.
Elaborate on that first, please.
Because honestly, at the end of the day, if your patient doesn't see it for themselves, you kind of have to see it for them.
Mhm.
So if nobody else is in your patient's corner, it kind of has to be you.
Okay, I like that. What's a profession that you would think speech pathology is most like? And let's try to use something that's not in the medical field, if possible.
Hmm. What are we most like? That's interesting. I would say maybe we're more like, I don't know why I'm stuck on zookeepers. I think for me
Okay.
personally, what it feels like in my day to day is that I'm managing different aspects. Like they all kind of have the same, if you think about like animals in a zoo, they all kind of have the same needs, but
Mhm.
they have to get addressed in different ways. So I kind of feel like that's what I'm doing, whether it's high level or low level, working on speech with one person versus feeding with another person. They all kind of have those basic fundamental needs, but they just get met in different ways.
I like that. That was a great on the spot answer. I like it. I like it.
I don't know
Okay, I
where that
like
came
it.
from. I was just stuck on zookeeper, so I went with it.
Yeah, no, that was good. I like it. I like it. And I'm a animal. I'm a fan of animals. I have like 10 pets, so that's a great example. Okay.
Yeah, that
Um,
was that was my dream job when I was 5, so I feel like that's where they came from.
See, my dream job was to be being off topic, but it was a like a wildlife ranger essentially. I forgot the proper name, and I always wanted to be one until like I think I was like 17, and I looked at like how much they make, and I was like, you know what, that's not for me.
Maybe let's go somewhere else.
Yeah, I'll just buy some pets.
Yeah.
What does a world look like without speech pathologists?
I think it would look like a lot more frustration, Like I said, fundamentally, we are helping people with the most basic need of communicating their wants and needs and kind of figuring out where they fit in society and finding their place. So if you have people who can't communicate their basic wants and needs, they're a lot more unhappy. Um, so I think it would look like a lot of frustration, a lot of people being misunderstood. So that's kind of where I feel like our need really is.
Definitely, I love it. Give us the good, the bad, and the ugly about your job.
Okay. So this is the one where I kind of have to really think about it because it's like it's bad, but is it really?
Yeah.
So the good, obviously, like I said, it is rewarding. I do get to be a part of people's lives and change in a meaningful way. So I'm always grateful that I get to do that. Don't take that for granted. Um, the bad, maybe I would say, and again, this varies because we work across so many different settings. We're just coming out of the holidays. I had to do a lot to work around so that I could get my holidays. Of course,
Mm.
healthcare never stops.
Yeah.
So on the days where we might have holidays, like your family and friends get time off, you don't get that time off. If you're not feeling your best, you're a little sick, you still have to show up for people. It can get stressful just because in my particular setting, it's so fast paced and there could be a lot of turnover. Things change one day to the next. So you really do kind of have to be on top of things. The ugly, I would say the one part of, and I think this is just healthcare in general, but the one part that I really wish could be changed is just the way administratively that things work. The healthcare system in the United States is really more of a illness system and not a wellness system. So we don't get all the resources and all the time and all the funding that we would like to be able to really make meaningful change. Sometimes people get cut off caseload like within a day just because the insurance ran out. So we really don't get to see that person make all the progress that they could make. So that would be definitely one of the more frustrating parts of the job is just administration, dealing with the healthcare system, and kind of that limiting us in some ways.
Okay. Do you feel like you off topic, off the speed round for a second? Do you feel like you've kind of been like asked to stop helping a lot of patients due to insurance reasons, and you feel like they could grow or be like yeah, go from your help essentially?
Yeah, I have. When I was doing my one of my clinical rotations in grad school, we had a Parkinson's voice patient, and he was making great progress. He was motivated. He came to his sessions always with a smile, ready to work. And then just one day he couldn't keep coming anymore. He was like, "I'm sorry, like I just can't come." His insurance, I guess, had run out. So it was really kind of sad that we didn't get to see him make his full progress because he really did have great potential.
Yeah.
But at the same time, I kind of was at peace knowing that we had kind of started giving him the tools to hopefully follow up a little bit on his own. So I never, of course, found out how that patient ended up doing, but I hope
Yeah.
he's doing well.
Okay, I love it. If piggybacking off like your statement you made a few minutes ago, how is burnout in like the speech pathology world?
Burnout definitely is something that we deal with. I've come out of a period of burnout recently myself, so definitely have experience with that. Part of it, I would say, kind of comes from the shortage. We do have a shortage of speech pathologists in the field. So you don't always get the access to resources, maybe having somebody come in so you can take a day off. That can be stressful to move things around. Just having such a high caseload. Or in my building, my rehab manager does what he can to kind of mitigate some of that caseload. But as soon as I discharge one person, here comes three more. So there's
Wow.
always a need.
Yeah.
It's it's kind of like, yeah, there's always going to be a need for you. So that can be kind of where the burnout and a little bit of pressure is also is like, oh, they need me. They need me. So
Yeah.
that can kind of feel like a big task as well.
Definitely. Okay, I like it. Okay, back on we're back on track. Are you underpaid or overpaid as a speech pathologist?
Um, in my current role, in my current position, I would say that I am adequately paid, maybe just a touch underpaid, just because my particular role is pretty stressful. It's
Mm.
kind of high. yeah, like high, fast paced, always needed. It does vary across settings. In other settings, speech pathologists are definitely underpaid. Schools, absolutely. Hospitals, absolutely. And again, that just comes from some of those reimbursement rates not really being adequate with the services that we provide. So a lot of speech pathologists get together and they advocate at the state and national levels for adequate compensation. So I'm really hoping to see some change in that regard as well. Of course, more money would always be nice, but it's
Definitely,
definitely for the services that we provide, I would say across the board. Across the board,
definitely.
generally, I'd say speech pathologists are underpaid.
Okay, nice. Do you think there's ever going to be like an adequate amount of speech pathologists for like hospitals, schools, and like the nursing facilities?
Uh, there could, I think, with some changes being made, just kind of making the profession be more widespread, more widely known about. Maybe changing a little bit of the barriers to entry, just like financially and as far as the requirements. And of course, like we talked about, with better compensation, I think that we could maybe get our numbers up.
Okay, not too big of a list. That's
Yeah.
doable. What's one person, book, or event that changed the trajectory of your life and why?
Ooh. So thinking about my current path and where I am in speech pathology, I really throughout the course of grad school, I kind of felt like I sort of lost my way on my path. Like when I was first getting into it, even back in high school, like I was always really fascinated by traumatic brain injuries caused by sports, and just kind of how the recovery process for that was. And so I was like, yeah, I want to do that. That sounds cool. But somewhere I got all this information thrown at me, and your obstacles in your way. So I kind of
Mhm.
lost my way from that. But actually, the last NFL season, when Tua Tagovailoa, the quarterback for the Miami Dolphins, had those back-to-back concussions, and he was stumbling off the field, they were like, "No, he just twisted his ankle. He didn't twist his ankle. That was a concussion, baby." So just for me, seeing how did they miss all those signs, and like how did he get back on the field so fast, and what was his recovery like, that really kind of got those sparks firing back again in my brain. So that's really what I've been trying to lean more into as of recently, is how do I kind of get back on that path to what it is that I'm really interested in.
So I'm sensing a career change, or am I tripping?
We'll see. Who knows what's there?
Yeah,
Definitely, like I said, I still want to be in the field of speech pathology. Direct patient care
yeah.
really has been so exciting and so rewarding for me. And so I want to still be in that realm. I think just doing it in a different way. So we'll see what the near future holds.
Okay, I like it. Okay, last question. Let's say we have a young Aris from a different universe, parallel universe, whatever, and she sees this interview and she wants to be like just like you. What's some advice and steps that you give her to get to where you're at currently?
Get around some good mentors and don't be afraid to ask for help. I know a lot of people say that, I'm sure they do, but the field of speech pathology is small. So, and for Black professionals, it's even smaller. 3% of all speech pathologists are Black, 8% are of color. So the field is 92% white, it's 3% Black.
Yes.
So get around some good mentors. There are people who are willing to help you, and that's something that I really wish I would have learned earlier. Is I spent a month just like cold emailing people who did anything remotely related to what I wanted to do, and people emailed me back. They set up Zoom calls with me and went above and beyond just because I asked. So asking for help, just kind of leaning on people early and often. That would be the biggest thing that I would say to do. It's scary, especially if you're not used to it, but do
Yeah.
it.
I love it. As a sales guy myself, I love the cold email tip. So
Yeah.
cold calling and cold emails will always work. Always,
Yeah.
always. Okay. Well, this has been a great conversation. I really appreciate you coming on here. If you have any last words, want to shout some people out, feel free to.
Well, shout out to Peyton. She's gonna hear this. So shout out to Peyton for getting me putting me on this interview in the first place. But yeah, just even if this sounds remotely interesting, please look into it. It's a field that is underrepresented but is growing, especially, and I won't go too far on this tangent, but especially with Black and Brown patients, students, whoever you might work with. They're underrepresented, and sometimes if you have a majority provider. We talk about this in healthcare all the time, but having somebody that looks like you and has a base understanding of where you come from and how you sound, that really can make all the difference in you getting the proper treatment that you need. So even if this just sounds remotely interesting, please look into it. Please get more information, and I hope to see you out in the treatment room.
Definitely. We appreciate you. Everybody, if you're still tuned in, please comment, like, and subscribe. Y'all have a nice evening.